So here we are going to talk about the normal blood count or lab values for entrance board. First one is hematocrit and hemoglobin. Hemoglobin normal values for men 13.2 to 17.4. In case of female 11.7 to 15.5. And some book wrote, and easy to remember, in case of men, it is 14 to 16.5. In case of female, it is 12 to 15 gram per dl. Hemoglobin, it is they transport oxygen to the tissue and transport carbon dioxide back to lungs. Or red blood cells are made up of hemoglobin. If this is low, we should think iron deficiency anemia. So if patient hemoglobin go down, hematocrit also will go down. Hematocrit is the ratio of volume of pegged red blood cell to the total blood volume. If hematocrit is low, it decreases in oxygen capacity and or overhydration. And if hematocrit is high, it is high if patient have a history of burn or diarrhea or polycythemia vera. So polycythemia vera, diarrhea or burn, hematocrit level go up. In case of men, it is 43 to 49%. Some books say it is 41 to 51% in case of man. In case of female, it is 38 to 44%. And some book wrote it is 36 to 46%. And what else? Second one, I want to talk about the red blood cell first, RBC. Red blood cell, they carry oxygen from lungs to the tissues around our body. And normal red blood cell for man, it is 4.7 to 5.1, 10.6 cell per cubic millimeter. In case of female, 4.2 to 4.8. But some books said it is 4.5 to 5, right? In times 10 to the power 6 cubic cell. What else? The white blood cell. So if the red blood cell is go down, patient develop anemia. White blood cell we shortly call leukocyte or WBC. And this is the body's defense against infection. So if any foreign body of any pathogen attack our body, WBC come first, particularly neutrophil and macrophage, and they try to kill bacteria. So chemotherapy would make this low. So if any patient take chemotherapeutic agents or organ transfusion, then white blood cell will be go down. And normal range 4.5 to 11,000. And some books say 5,000 to 10,000 per cubic millimeter of blood. What else? And third one is platelet. So platelet. So if the WBC go down, patient easily attacked by infection and fever develop. Platelet, it is very important to stop the bleeding. So platelet are the smallest of the three major type of blood cell: red blood cell, white blood cell, and platelet. Out of these three, they are smallest. So white blood cell, red blood cell, or platelet, they mate in the bone marrows. Particular platelet function is to prevent the bleeding. The normal count, 150,000 to 400,000 or 450,000 in microliter. So there are one very common medication named aspirin. Aspirin medication will quickly disrupt the platelet function. What else? I wrote some note here. Blood bleeding time and clotting time. Normal clotting time 8 to 15 minutes. But normal bleeding time, shortly called PT, 1 to 8 minutes. What next? Activated partial thromboplastin time. It is 25 to 35 seconds. Prothrombin time, PT, 10 to 13 seconds or 10 to 14 seconds. And PTT means partial thromboplastin time. It is 30 to 35 seconds. It is important for our NCLEX board exam.